So there's a little bit of information starting to come out. Some of it's still anecdotal. Physicians who are seeing a lot of patients and trying different treatments are saying this treatment seems to work better than another, and that's what you're probably reading in the news media, why certain anti-inflammatory drugs are being recommended over others, because some of them appear to be more associated with severe outcomes. There are a few carefully controlled trials beginning, and the first reports on some of these are just starting to come out, where a drug is compared directly to a placebo. That's the only way that we usually know whether it really has an effect or not. The first one was just published yesterday on a 2-drug regimen that's been used for HIV in the past, which does not seem to offer any benefit for SARS coronavirus patients. So there's one drug that is being used right now in what we call placebo-controlled trials around the United States. This is a drug called remdesivir that has been used during Ebola outbreaks, and it's a drug that has been approved by the Food and Drug Administration as an investigational new drug. That means it can be used experimentally in clinical trials with people to determine whether it can eventually be licensed for treatment of something like the coronavirus infection. So this is a drug that's already been in a lot of people, so we know that it's a fairly safe drug, and there's some reason to believe it may be efficacious against the coronavirus. So as soon as we start having a lot of patients in our hospitals, in the Texas Medical Center, including here in Galveston, that drug will be administered to some of those confirmed infections, along with others will receive a placebo, or if there's another drug that's been shown to be efficacious, remdesivir would be compared to that drug. And then we'll start getting firm answers about whether remdesivir is really effective in preventing disease in these coronavirus infections. There are a number of other drugs being tested in a similar way, including chloroquine. Chloroquine's a very old drug used to treat malaria for a long time. There's some reason to believe it may be efficacious against some viruses, including the coronavirus. So we're going to be seeing a lot of these clinical trials ramping up very quickly here in the US, and we're going to start to see hard data coming out on efficacy over the coming weeks.